Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is there any difference between men and women who present with antisocial personality disorder? Antisocial personality disorder is a cluster B personality disorder in the Diagnostic and Statistical Manual. This is the emotional, erratic, and dramatic cluster. So this is the same cluster that contains narcissistic, borderline, and histrionic personality disorders. And it's long been theorized that there are differences by gender with this disorder. To help answer this question, I'm going to be using an article that was published in 2013 by Allegria and colleagues that looks at the specific question of antisocial personality disorder by gender. Now, we consider the definition of antisocial personality disorder. We see that there are 7 symptom criteria listed in the DSM. We see repeatedly violating social norms, like engaging in activity that would be grounds for arrest, deceitfulness, impulsivity, irritability, and aggression, as indicated by getting involved in physical fights, a reckless disregard for the safety of self or others, irresponsibility, and lack of remorse. We know that in order for an individual to be diagnosed with antisocial personality disorder, they have to be 18 years of age or older, and there must be evidence of conduct disorder apparent before the age of 15. So there is no such thing as late onset antisocial personality disorder. As a matter of fact, there's no such thing as a late onset personality disorder in general. All 10 of the personality disorders have an early onset of symptoms. Now, with antisocial personality disorder, we know that there is a difference in prevalence by gender. 75% of those with the disorder are male and 25% female. And we know before this particular study I'm looking at here today that there were some differences noted in the research by gender. Males with antisocial personality disorder are more likely to have multiple arrests, multiple traffic offenses, to have a history of setting fires, using weapons, starting fights, being cruel to animals, and they're more likely to meet the reckless disregard for the safety of self and others criterion. Females with antisocial personality disorder are more likely to have impulsivity, multiple sexual partners, a lack of remorse, and to have run away from home when they were younger. Now, when we look at the results from this particular study I mentioned earlier, we see that there is a higher rate of adverse childhood experiences noted with women with antisocial personality disorder as compared to men. Also, a higher rate of disturbance and disability. Specifically looking at the adverse childhood experiences, ACEs, we see more childhood emotional neglect, more parent-related adverse experiences, and more sexual abuse. Men and women share the same risk of having a comorbid mental disorder. That's a mental disorder in addition to antisocial personality disorder. But women have more severity of symptoms, and they have less social support and also less social functioning. With men, we see more illegal and violent acts. With women, we see more nonviolent antisocial behavior, like missing work or school. Now, this particular area brings up concern of underreporting or underrecognizing of antisocial personality disorder. That is, more likely that we would see a misdiagnosis of antisocial personality disorder when it comes to women as opposed to men. Now, these findings support a specific theory that has been put forth in relation to antisocial personality disorder and how it's different in men and women, called the threshold of risk hypothesis. It's also called the group risk hypothesis and the sex paradox. And what this theory says is that there is a higher loading of risk factors that is necessary for women to manifest antisocial personality disorder. And this could explain the higher level of impairment seen with women and the lower prevalence of the disorder seen with women. So what can we learn from this study about antisocial personality disorder and how it affects men and women? Well, we know here that we need to be aware of potential differences by gender with this disorder. And we need to use care when assessing antisocial personality disorder to reduce the risk of misdiagnosis. I hope you found this description of antisocial personality disorder and gender to be interesting. Thanks for watching.